Well, I'd like to welcome you to to our medical marijuana awareness seminars. Today's topic is on chronic pain, a subject that is near and dear to a lot of people. If you have chronic pain or you're living with pain or dealing with pain management, it's something that you definitely have to put up with and something that you have to live with. And hopefully we can give you some solutions and some tips on what you can do by using medical cannabis to help you with your particular lifestyle medical condition. My name is Marc Matoza. I work with MÜV-Altmed today, and I'm going to be one of the hosts for today's webinar. I do want to say that this webinar is serious. We take these subject matters very seriously, and we take what we're doing very seriously. And we'd like to be able to keep this on a professional level. We're not trying to be political. We're not trying to give medical advice. All we're trying to do is provide information to hopefully help you get your life back and live a better life. I've always said that my goal of doing these webinars has been, if I can help one person in each one of these webinars get their life back, then I think we've been successful, and hopefully that can be you. One of my co-hosts today is a lady that I've done seminars with in the past, and is someone who really is somebody who really knows the medical cannabis field. Kate, would you introduce yourself and give us a little bit about who you are?
Well, thank you. Marc, first of all, I just wanted to say thank you for everything that you do to help educate patients or potential patients in the state of Florida with regards to medical cannabis. You're a huge asset to our entire state, and you've done a lot of educating and have helped a lot of people get their lives back. So thank you. My name is Kate Palazzolo, and I am the regional sales manager for MÜV. We're a dispensary. Our home base is in Apollo Beach, Florida, but we have 25 dispensaries now open to serve patients throughout the state of Florida. So I am the regional sales manager, and I go into clinics and I educate physicians and their staff, and sometimes even the patients on all of our products and how they can help their patients.
Great. Well, I know that MÜV has done a really good job. You're opening up a lot of dispensaries here in Florida. We're going to talk more about MÜV at the end of the presentation, but I think right now what I'd like to do is I'd like to kind of focus on is really set a ground, it's kind of a ground rule, kind of an area where we can start looking at some slides that will give us some background to really address this chronic pain problem. And then also for everyone tuning in, please look at the bottom of your screen. You'll see a little buttons. It looks like Q&A. They look like two that are together. Please feel free to ask any questions that you want. Our goal here is not only to just provide you information, but also to answer any of the questions you might have. There's a chat button that you'll see, but I think what we're going to really do is follow the Q&A, be able to use that if you have any questions. So I'm going to go over, I don't want to make this a slideware presentation. That's not my objective. But what I do want to do is I do want to have some slides that kind of set the background and the tone for what we're doing. And so that's what we have here. As we mentioned before, we take this seriously. What we want to do is talk about the safe use of medical cannabis and also to really provide education. This is a sensitive subject for a lot of people, but I think also please make sure that whatever you do, anytime you're dealing with your health, please get your physician involved, and especially a medical marijuana doctor if you're going to use medical cannabis. It's very, very important that they become part of your support staff, as well as the dispensary itself. Kind of the holy trinity of medical cannabis is the medical marijuana doctor, the dispensary, and yourself. And I think it's important that we take a look at that. I think that what we want to do is we want to bring together a number of people, bring together a lot of comments. So anyway, so please feel free to bring your questions in and we'll be able to answer that. Now, I want to start this webinar, since it's on pain and pain management, I want to be able to bring you a little tip, a little video from Sanjay Gupta that may be appropriate to kind of set the tone for this.
THC, which is a psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
What opiates you're talking about? Killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on two receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, two plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe. In part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
I think that's important to understand and to see is what they're talking about here because let me go back a little bit, because what's interesting is that we had remedies like cannabis that were really not only helping with chronic pain or with pain management, but also with inflammation. And inflammation has a lot to do with your pain. And the problem is it was taken away from the doctors. And it was taken away for political reasons. I say that because a lot of people that are new to cannabis are worried about how safe it is. And I just want to say that it is safe. No one's ever died from using it. And the decision to make it illegal was more political than it was medical. So let's talk about chronic pain for a second. So what is chronic pain? Chronic pain is something that persists for 3 months or more and that occurs regularly. Typically, when you have acute pain is something where you maybe break a finger or you have some sort of an injury, and then it heals over time because you go to the doctor, get a cast, or whatever is there. Chronic pain, what they found out, consists of a number of different things. In fact, what they found out about chronic pain, it usually has to do with two things in your body. It could be inflammation causing some pain from the swelling, and it could be some other condition that's in your body. You may have hurt your shoulder, you may have pulled a muscle, you may have done something like that. And that's what's made chronic pain so hard to be able to diagnose, is because your doctor wants to put his finger on one problem and solve that one problem, when in fact chronic pain is not one problem. It's usually two or more conditions of your body that create that situation. As mentioned, acute pain is something that's related to a specific injury or an illness, and it usually goes away in a few months. Chronic pain is something that comes on gradually, and then by the time it gets there, it's there. And people, I know that when I talked to the doctor 5 years ago, and I talked about chronic pain, he literally told me chronic pain didn't exist. And 5 years ago, the doctors didn't understand it was more than one medical condition. Today, they do understand that it exists. In fact, chronic pain is now listed as one of the top reasons for long-term disability here in the United States. So it's a serious condition. I think more importantly, when you take a look at it, it's the number one reason that people use medical cannabis. I find that very interesting. The number two reason, by the way, is because of stress and anxiety, which we are seeing in this particular time. But a lot of people, especially people like, I'm a senior citizen, I'm over the age of 65, we have chronic pain. It comes from just your body. That's the way it works. And it's interesting, there was one study that was done about 2 years ago that basically showed that 62% of the people that were using medical cannabis were using it for pain management. And I find that's interesting to be able to look at that. Important is a couple of things. First of all, it is a drug, it's an exit drug, not a gateway drug. It's not going to lead to opioids. In fact, we had a webinar a week ago that talked about using cannabis as an exit drug, not a gateway drug. You're not going to get addicted to it. In fact, if anything, it'll help you get off of opioids. And more importantly, nobody's ever died from using cannabis. That's very, very important, because one of the things is that it's safe. For opioids, as we know, are not safe. We're losing 131 people a day, and that's the latest numbers that they've been reporting. So it's something that we need to take a look at. When you take a look at what they call NSAIDs, which are really your ibuprofens, your different over-the-counter medications, your Percocets, that type of thing, what happens is they attack your basically your kidneys and your GI system, and it causes long-term damage. So really, that's not really a good alternative, although it does help. It's not something to be used long term, and what you got to really pay attention to, things like Tylenol have some serious issues of damaging your liver going long term. So what we have is a natural substance that can help it is as effective for pain management as the prescription drugs, and yet obviously you got to have a medical marijuana card to use it, but it is there and it's something that does work. What's the evidence of that? There's been a lot of studies that are done, although we can't study in the United States, we can't study medical cannabis. We can take a look at people that are using it, and that's what University of California did. They had people that knew they were using medical cannabis because cannabis is in California, and all they did was report the results of that. What they found out is that neurologic pain is something that's helped by using medical cannabis. Also, researchers in McGill is in Canada, it's in Montreal, and they've also found that it helps not only with pain, but also with sleep, anxiety, and what they call refractory pain. These studies were done, and like I said, this one was a 2019 study that came out. And what's interesting, it found 80% of the participants found that this is something that's very helpful, if not extremely helpful, to manage their pain. So there's a lot of evidence and a lot of studies that are there, especially outside the United States. We're going to provide some reference material to you after this webinar. You'll get an email follow-up that you'll be able to take a look at and see. But there's a lot of evidence that medical cannabis is something that can help you. So the question then becomes, how does it help you? And that's where we have the endocannabinoid system. And I don't know if you've heard about the endocannabinoid system or not, but it's a system that's inside your body. It's very, very similar to your nervous system. In fact, it works in conjunction with your nervous system, and it's something that helps your body helps regulate itself. I'm going to play a little video that probably is going to help you understand what the endocannabinoid system is, and then more importantly, how it can affect pain. And I'm also going to have Kate make some comments, because I think she has some good insights into this as well. So let me take a look at this video first.
Things in our body called endocannabinoids. Okay, they're endogenous cannabinoids. A lot of times when we think of cannabinoids, we think of only something that's coming from cannabis, something that's illegal, or something that really is an exogenous thing coming in. The reality is we have endogenous cannabinoids. They're called endocannabinoids, and they have an anti-inflammatory effect on the body. They're a very natural thing, and they're a natural byproduct of fatty acid metabolism, believe it or not. So these endocannabinoids are naturally occurring members of what are called the eicosanoid family. If you've watched some of my other videos, you know that I talk about eicosapentaenoic acid, also known as EPA. If you've ever bought a fish oil pill or any kind of omega-3, you've seen eicosapentaenoic acid, or EPA, on the label, an anti-inflammatory fat that modulates inflammation and does a multitude of other things within the body. Well, these endocannabinoids are a naturally occurring member of that superfamily. So within that family, we have a lot of different things that modulate inflammation. And in this particular case, endocannabinoids are derived from long-chain fatty acids. They are a byproduct of the breakdown of long-chain fatty acids, meaning it's a very natural process to have cannabinoids in our system. So what ends up happening is they're produced by fat, but then when they're actually needed, when they're actually solicited to be used for something, they're released by the neurons. So we have these fats that are broken down, and we end up with these overall cannabinoids. But they don't get released until the neurons say so. So the neurons actually see some inflammation, or they see something, they're going to release more of these to modulate. So it's this natural progression of fats communicating with neurons to ultimately release these endocannabinoids. So let's take it a little bit further.
That's very, very important. And the reason it's very important is because in our bodies we have what they call CB1 and CB2 receptors. And these receptors are located throughout your entire body. What's interesting is those CB1 and CB2 receptors work with your CBD, CBNs, and THC. They fit like a lock and key to be able to help you be able to your body be able to modulate itself. It helps with pain, it helps with memory, it helps with appetite, it helps with inflammation. It basically is the way your body helps to regulate itself. And the easiest way to understand that is that you have CB1 receptors, that are primarily in the brain and in the central nervous system, and you have CB2 receptors that are primarily located in your organs. Kate, do you want to make some comments about this?
Yeah, so basically, this is a lot of information to take in, and I think of it like this. So your endocannabinoid system helps to regulate your mood, your appetite, your memory, your level of pain. And basically, when a patient has chronic pain, for example, the endocannabinoid system is supposed to be like this, regulated and at homeostasis. But when you have chronic pain, you're out of whack. And so basically, your endocannabinoid system can be hijacked by CBD and THC and help to bring you back to that homeostasis state. So that's basically in a nutshell how I like to explain it.
Yeah. Harold, you asked a question, and I'm going to answer that question in a minute, but let me give you a few slides that'll set the stage for the answer that we're going to provide you. What we were talking about here is that you, as a person, produce endocannabinoids. That's something that your body uses to be able to regulate itself. You can also have endocannabinoids or what they call photocannabinoids come into your body via what they call plant-derived. This is where medical cannabis comes into place. Whether it's buds, tinctures, extracts, whatever, it can also go in and help your body be able to have endocannabinoids in the system to be able to, again, regulate your appetite, your pain, your pleasure. Now, there is a synthetic version of cannabis that's out there. It's called Mirinol. It's THC only. It doesn't have any CBD in it. So it's used for very specific things and really should be used only under the direction of a doctor. It really is not something that's something that is going to be helping you with the entourage effect and some other things that'll help your body. But it is out there and you may hear about it. And if you hear about it, please, that's a red flag. Please go talk to your doctor. It's something that you got to be very careful of. But the photocannabinoids and the endocannabinoids are something that you can take a look at. As I mentioned, I'm over the age of 65. My body doesn't produce the same amount of endocannabinoids as it did when I was younger. And so what I'm able to do is I'm able to take those endocannabinoids and they actually go into my fatty acids. And they don't go into the CB1 and CB2 receptors. They go stored in my fatty acids. And you look at the fatty acids as like batteries that are helping me out. And when my neurons, when my nervous system, when my brain sees that I have a problem, what it does, it breaks those fatty acids down into long chain fatty acids. And then what they then do is they then get produced and they're distributed into your body through your blood system. Now, this is important for two reasons. The first reason is, this is the main reason why no one has ever died from using medical marijuana. Because all marijuana is something that just goes right into your fatty acids and then your neurons take over from there. It's your body producing your own medicine. And that's really critical. It's not a foreign substance. It's not something that your body's not normally used to. It's something that really helps you from the standpoint of nature's solution. That's one. The other thing that's important here is in your body knows where your problems are. Your nervous system knows if you have inflammation, if you have pain. It knows if you have some things that are out of balance. And so it doesn't discriminate between one type of problem or another. There are many patients, my mother, for example, started taking medical cannabis to treat breast cancer. She went to the doctor, to a glaucoma doctor 4 weeks later, and the doctor said, "You don't have glaucoma anymore." He asked her what she was doing, and she mentioned she was using medical cannabis. And he said, "Yes, medical cannabis is an effective treatment for glaucoma." And this is called the entourage effect. This is where your body knows where you have a problem and still will go out and solve it. It's not looking for just any problem. It's looking for all the problems that your body has, and it's trying to provide a solution to that. And I think that's something that's very, very important. This shows you why you're not going to die from using medical cannabis. It also shows you how the entourage effect makes. Kate, you have any comments on this?
Not real. I'm not sure where are we heading toward the yes.
Let's talk about the comments, because what I really want to head to is when I got involved in this business 6 years ago, I heard a lot about what they call sativa and indica, and we've progressed a lot since then as far as being able to provide true medicines. But why don't you tell us a little about sativa and indica? Okay.
Right. Okay. So basically, sativa, for me, I like to think of it like sugar. It starts with an S, sativa, sugar. So any product or strain that you have that has a sativa leaning is going to be a little bit more uplifting, a little bit more energetic. So you think of a citrus, a lemon, or an orange is going to be a little bit more uplifting. So you're probably going to feel a little bit more awake than you would with an indica. And a lot of people like to say indica is in the couch. So it makes you very relaxed, very calm. It's a great starting point if you're looking for where you want to lean toward, if you're looking to be more relaxed and fall asleep, or if you're looking for something that's going to get you through your day without giving you as much of a tired feeling. But typically, as far as the cannabinoids are concerned, I like to use the indica and sativa as a starting point. And then from there, we like to look at the terpenes. So what they're finding is a lot of the research that's been done up until now is that really it's the terpene profile and the flavonoids that are giving you the most therapeutic benefits. And so the terpenes are non-cannabinoids, and they're responsible for the aroma of each of these strains, which can give you a wide range of medical benefits. So an interesting fact, many steroids are actually made up of terpenes. So you can find terpenes in natural plants, like say mango, for example, blueberry, any type of fruit is, and also just any plant really has terpenes in it. So you think of terpenes as aromatherapy, just like lavender makes you feel relaxed, and a citrus is going to make you feel more energetic. And so with that, a lot of patients will come into the dispensary and they're looking for a particular strain, because certain strains have particular terpene profiles, which might help relieve them from their symptoms that they're trying to get relief from. So typically, into whether it be a MÜV dispensary or any other dispensary, that they communicate with the med tenders about their symptoms that they're trying to get relief from, so that they can help pick out the appropriate strain based on the terpene profile, so they can get, you know, relief or feel more relaxed or feel more alert. And we can cover the terpenes in just a minute, right?
Yeah. Yes, and that's a really good point. I think that what I found out when I had an auto injury about 4 years ago, it left me with 2 herniated discs in my back and 7 in my neck. And I found out that so I started using medical cannabis, because the Percocet they were giving me, it was impossible for me to be able to work and be able to lead my life. What was interesting is when I went to the dispensary and I said, here, they looked at my profile from the doctor, and they said, here's the products that you should use. And of course, if you look at the dispensary that I have behind me here, you'll see that there's a lot of products, and I didn't know how they figured that out. So about the second or third time I went there, actually the third time I went there, I asked, how do you know? And they said, it's very simple. We're looking at your recommendation, at your condition that you're trying to treat, and we're matching that to a terpene profile and also to a cannabinoid profile to be able to provide you the products that'll basically benefit you. And that's when the light went on to me. These cannabinoids, which people call strains, you probably hear that as different strains that are out there. These are being developed specifically to help with various medical conditions. And it's a matter of not only the cannabis, but also the terpenes to be able to help you with that. This is medicine. And so it really answers the question of, gee, I can just smoke a joint and get it and get the same effect. The answer is not really, because what you're not doing is you're not homing in and targeting in on the problem that you're trying to relate to. In my case, for example, it was pain, but my pain also came from inflammation. So I had to really resolve 2 things, 1 inflammation and 1 pain. One thing I want to point out is every person's body is different. If your body's going to produce its own medicine, it'll do it its own way. So this is not a medication that's like, take 2 aspirin and call me in the morning. This is something where we typically, what they call go low and go slow. So we'll start with maybe a one-on-one CBD and THC, see how that works. And then over a period of a week or two, we begin to see how it affects you. And then we adjust your dosing to be able to get you the right formula for your particular body and what you want to do. So it takes a week or 2. In my case, it took me about 2.5 months to really get the formula right, because I have a severe amount of pain. I wake up in the morning at a level of pain of a 7 or an 8. So it was something that we really had to get right. But it was something that now that I do have it right, which I did about, like I said, over 4 years ago, I got my life back. It is wonderful. And one of the reasons why I play in this particular party. So let's talk about terpenes. Tell me a little bit about terpenes, Kate.
Okay, so basically, terpenes are really what is responsible for giving you the relief that you need when you're talking about particular strains. So I can read off here. It says terpenes are the most common plant chemicals in nature. So you're going to find it in flowers. You're going to find it in spices, fruits, vegetables. So, you know, for example, linalool, you look down here, it's a lot of times the terpene comes from a lavender plant. So typically when I use lavender, I'm burning a candle or I'm getting a massage, and it's very relaxing. But the effects that if I'm trying to get relief would be, it's a bronchodilator. It's going to help with anxiety. It's definitely an anti-inflammatory, and analgesic and anticonvulsant properties. So if you're looking to get relief from any of those type of symptoms, you're going to go into a dispensary and try to find the strain that has linalool in it. Now, a lot of these actually do have anti-inflammatory effects. So alpha-pinene is an anti-inflammatory. I think, yeah, myrcene is an anti-inflammatory. And basically the med tenders can help you with this, or you can go to, there are several different websites you can go to research what particular terpenes might help you if you'd like to be educated before you come into a dispensary. Caryophyllene is a very popular one. That's antidepressant, antibacterial, anti-anxiety. And you know, what we have found is that a lot of patients who suffer from chronic pain end up having depression. And so if you have something that's an anti-inflammatory and an antidepressant, that's going to be the best terpene profile for you.
Sure. And how this all works is you've got an endocannabinoid system in your body that is there. The amandinide is something that's the driver. That's the thing that says, okay, you have a problem. Let's go resolve it. The cannabinoids are the passengers. That's what's passed down to that part of your body to be able to help you. But really, it's terpenes that really guide it. It's the GPS. As you were mentioning when you're going over the different terpenes, they have different profiles that really help you hone in and be able to address that particular problem. And that's what's really important. If you have a particular medical condition, there is probably a strain of cannabis that can help you. And that strain is based on not only the cannabinoids, but also the terpenes that are there.
Mm-hmm.
So let's dig down on a few of these. You want to talk about caryophyllene?
Sure. So caryophyllene is, I think it's actually the terpene that is found the most in nature. And a lot of patients will get that. You can get it obviously in your cannabis, but you can also get it it's in pepper, it's in cloves, and a lot of spices. Basically, it's going to help you with your pain. It's going to help you with anxiety and depression. A lot of patients get a decent amount of relief when they find a strain that has this for these problems.
Right. And then there's limonene as well.
So, yep. And so limonene is usually, now when I'm going to go back and talk about the indica versus sativa. Now, what I found is a lot of these, you think about it, limonene is going to be more uplifting. So you're going to find that in typically more sativa strains. So it's, if you're looking to get through your day with anxiety, depression, inflammation, and these type of issues, but you don't necessarily want to fall asleep with it, terpene profile with limonene in it is going to be a good one for you.
Sure. And then there's pinene, which you mentioned.
Mm-hmm. Yep. So the alpha pinene, that's also going to be a more uplifting terpene, but it's going to help patients with not just pain and anxiety, but it's also going to help them with their asthma, which is great. Potential side effects, alertness. Yeah. So typically the way I like to remember it, and it's not true for all of the terpenes, but for most of them, if it ends in an E-N-E, if it's an ene, it's going to be more of a sativa and more uplifting. So that's kind of my little cheat sheet when I'm looking for terpene profiles.
Well, the pinene is interesting because one of the things it does is help with memory retention, which is great. That's the good news. The bad news is if you're a PTS patient, that's one of the things you don't want to use. Okay,
right.
It's something because you don't want to bring those memories back is what I'm trying to point out, or dwell on them. Let's put it that way.
Right. And so, yeah, so if you do have PTSD, we usually try to, and physicians try to steer patients more toward an indica just because it is less memory. You forget a bit more, making you a little bit more relaxed, and it's more to relieve you from those type of anxieties.
Sure. And there's a number of questions that I see people are asking, like Angel and Howard. We'll get to those in just a second. I think we want to be able to get this basis out of the way. Let's chat a little bit about linalool. This is probably one of the most popular terpenes that are out there.
Mm-hmm. And this is going to be a very relaxing one, fairly sedating, and it does help a lot of patients. Most patients have come back and told me that the best strain for them to fall asleep and fall asleep quick and feel relaxed is going to be with a lanolone. So that helps patients with anxiety, depression, insomnia, inflammation, and pain. So that's good.
Right. And myrcene. Myrcene is very popular.
Yes, myrcene is. And, you know, myrcene, also with this picture, you can find myrcene in mangoes. So helps patients with pain, inflammation, insomnia. Also going to be a very sedating strain. So if you see myrcene and you're looking to get a good night's sleep, that's probably going to be a good one for you to help you with your pain and insomnia and a good night's sleep.
Sure. And I do want to point out that when you take a look, and by the way, you'll get a follow-up email to this webinar. There is studies and research that's been done, and you'll get copies of this. You'll be able to look up each of these studies. But this is something that comes from some grounded medical research, not necessarily from somebody on the side just thinking about it. Most of this research, however, was done outside the United States. In fact, almost all of it's done outside the United States. And that's why we're trying to provide it to you and get you the straight information on it itself. I want to answer a couple questions before we get into dosing for a second. One of the questions that came up, I think that's appropriate, and Harold asked this, is does high THC and or CBD test / THC blend work more effectively to control chronic pain? Do you want to answer that, or do you want me to take that, Kate?
Oh yeah, absolutely. So all of the chemists that work at our company, they're PhD chemists with at least 10 years experience in plant medicine. And what they have found to be the truth is a 1-to-1 ratio of CBD and THC work better for everybody across the board, just because the CBD is going to work on your inflammation and the THC is going to take your mind off of the inflammation. So definitely for chronic pain, a 1-to-1 ratio of both CBD and THC work best. Now, the thing about CBD is CBD actually works to downplay the psychoactivity associated with THC, and THC works to amplify the anti-inflammatory effects of CBD. So they work hand in hand. They're like two best friends working together. And definitely, if you have the opportunity to have them together in a strain or whatever it may be that you use, whether it's a patch or a cream or a vape, whatever it may be, definitely I would go for the 1-to-1.
Yeah, I think, and I'll second that. In dealing with a number of people, I found that the 1-to-1 works better, and primarily because a lot of pain comes from inflammation. So if you can address the inflammation, you're really addressing the pain. If you address the pain only and you don't address the inflammation, you're really not going to solve the problem. You're treating the symptom and not treating the problem itself. And that's like in my particular case, I have to really pay attention to inflammation, and I have to pay attention to pain. And I noticed that the best way for me to control my pain is to control my inflammation. And that's where the 1-to-1s come into play. We'll talk about dosing methods in a minute, and I use a patch for a lot of that, but it's something that's very effective. So I would say THC, CBD blend, the 1-to-1s are probably a good place to start, especially for chronic pain. One of the other questions that Angel asked is, what are the best hybrids which can give you both the crossover between indica and sativa for pain management? Do you want to touch on that one, Kate?
Okay, well, so for pain management, I would say definitely a grape bait, any indica, typically Cush's, chunky diesel. Those are some good popular strains for relief in that respect. But basically, there are two different things that I would recommend you do. One, go into a dispensary. You can come into a MÜV dispensary, and one of our med tenders will look at what strains are available and let you know which one is going to be best for you. The other thing you can do if you want to do a little research before you come into a dispensary, you can go to StrainPrint. StrainPrint is an app that you can download, and that will give you a lot of information about different strains and their benefits.
Right. I know that it's something that's it's something to really pay attention to. Homing in and finding the right dosing for you, meaning the product and how much you take and when you take it, is really key. I take cannabis in the morning when I wake up. I take it in the middle of the day, and I take it at the end of the day. Because in my particular case with herniated discs, they don't go away. This pain isn't going to just magically go away. I mean, I've after consulting a number of medical doctors on my neck with 7 herniated discs, there is nothing they can do. I mean, literally. There is no surgeries, nothing other than prescribing me a bunch of pain pills, which really don't really solve it. Medical cannabis has given me my life back. I live with a level of pain of less than 1 on a constant basis, and I'm clear-headed in the way I think. I can't in my particular business, running 6 websites and 4 social media networks. I can't be crazy. I can't be out of it. I guess I could, I don't know. But I think the point is I have to be able to stay and be myself. And really this helps by being able to modulate the pain and the inflammation has really done wonders to let me be able to continue my life. One of the other questions that I think, one of the questions, I'm going to go down here. Eileen mentioned that taking omega-3 does it do the same thing as cannabis? The answer is no. Medical cannabis has 450 medical properties, and each of the different strains, we didn't bring the CBD oil in on this presentation, I guess we should have, but those medical properties are something that really help address the different various conditions in your body. The omega-3s really are more, are gonna really help really set the stage for that. It does help. They have medical properties, about 8 to 10 different medical properties, but not the same amount of medical conditions and properties that medical cannabis has. Kate, you want to make any comments on that?
Yeah, I mean, there are a lot of great health benefits with omega-3s. You know, it's supposed to help you fight anxiety and depression, if that's what we're talking about. But yeah, there are a lot of health benefits to omega-3s, but I would say the health benefits might outweigh if you're using the CBD and THC. That might be a good discussion to talk over with your medical marijuana recommending physician, who can better guide you, just so you're not taking too much or overloading your body with too much.
Right, right. And Aaron, I see your question about medical marijuana and law enforcement. We'll answer that one in just a minute. That's a very good question. But I want to maybe get back on, let's talk about how you take medical cannabis. I know that when I first got in this business, I just had a hard time thinking about a lot of senior citizens smoking joints on the front porch. We are so far past that. I guess that's my past when I grew up as a kid. We are so far past that today that that's not even very popular in the dosing forms. But there are different ways of taking cannabis: sublingual drops, vape pens, capsules. Let's take a look at a chart on how they're used. And Kate, do you want to talk about this a little bit?
Sure. So, so you can look at the chart and you can see that sublingual and capsules and edibles are typically, well, actually it says sublingual here is 15 to 40 minute activation, and that is pretty typical. And as far as the edibles and the capsules can be anywhere from 30, 60, usually 90 minutes on average to actually feel the effects of the cannabis. I will say our company at MÜV, we're a little bit different in that our sublingual, our capsules, and we don't really have edibles, but we do have the distillate syringe, which you can put in your mouth. And all of ours are water soluble. And basically, by it being water soluble, it does not have to get digested. So your body doesn't have to go through that whole digestion process to feel the effects. So our sublingual is usually about a 15 to 20 minute activation time. Our capsules are usually take anywhere from 20 to 30 minutes tops for you to feel the effects. And same with our spray. And the benefit to that is typically when a patient ingests THC, by it going through the digestive process, it actually gets converted from delta-9 THC to 11-hydroxy, which will make it about 10 times more psychoactive than what regular THC will do. So if you've ever heard a story about somebody who they ate a brownie, for example, a THC brownie, and then they couldn't move their legs, or the ER freaked out, it's because it got converted to that 11-hydroxy, which can increase the psychoactivity by 10 times the normal and give people some massive anxiety, enough to have some bad effects. Now, if you're somebody who's been using cannabis for a really long time and you have a built up system and you actually require more, that added psychoactivity, that added kick, it might be what you need to give you the relief that you're looking for. And then as far as vape pens are concerned, that's almost immediate. Now, the most efficient and the most bioavailable way to get cannabis into your system is through inhalation. So the vape pens are very good with that if you're looking for immediate relief. It's not going to last as long as anything that you're ingesting, but it will definitely give you that immediate relief. And then as far as topicals are concerned, now, a lot of people might not even really like topicals as far as cannabis is concerned, because the reason is they don't really work all that well. But with our topicals and with our patch, it's transdermal. We have a patent on it. It's called the Evolve Transdermal Gel is what we have, and the transdermal patch. And basically, we've changed the properties of the cannabis from being fat soluble to water soluble. So you can put the patch on, or you can put our Evolve Gel on, and it's going to break through the barrier of your skin and actually get into your bloodstream for not just localized relief, but systemic relief. So patients really do like that. And, you know, typically patches on the market, they're anywhere from 8 to 12 hours. Our patches are actually 72-hour patch. So it's a 3-day patch. You can put it on and forget about it. And what patients love about that is that they're not going to have those highs and lows throughout the day. They're going to be a little bit more even keeled. And then, you know, nighttime rolls around, they're going to need something a little bit more usually. Not always, but some patients might, you know, as the day wears on, are going to need something to help them get through the evening and help them fall asleep. So they'll keep that patch on and then, you know, go use a vape pen or an edible.
Yeah, I'm a huge patch fan, I have to tell you. And I want to chime in here for a second. I think people, you don't have to look at just one form of dosing. Let me give you an example. When I wake up in the morning, I've got a very high level of pain. So what I do is I take my sublingual drops, and they're going to take me, typically for me, it takes about 20 to 25 minutes for them to work. But I also then right next to it, I have a vape pen, and I take 1 or 2 hits off my vape pen, depending on my pain level. And literally, within 2 minutes, my pain goes from a 7 or an 8 down to a 1. And I have to tell you, when that happens, especially the first time it happens, I said to my wife, this is just crazy. What's going on? And even when it happens like this morning, it just amazes me how fast the vape pen works to be able to relieve my pain and get me down to a place where I can just be myself. So it's a matter of sometimes mixing some things together. I use a lot of one-to-ones, like in the middle of the day. That's something that's important. And because of that, I like to use the transdermal patches, because what I'm able to do is I'm able to put a patch on, and literally for the next 3 days, I don't worry about my middle of the day dosing treatments. It's something that really helps me. And I love patches. I think it just makes my life so much easier, because I'm always worried about, did I take it, did I not take it? And sometimes, especially prior to COVID, I used to get very busy traveling and visiting people and talking and lecturing. And this would allow me to be able to come in and be able to just ease my dosing, but still get the cannabis I need to be able to help me out quite a bit. So it's something that's there, and I think it's important. It's something that you need to be individualized for each and every person. You got to find out what you like. Some people may not want to vape. Some people may prefer capsules over sublingual drops. Topicals work great. I have to tell you, the MÜV has a great topical for pain. I highly recommend it. I highly recommend the patches. They're kind of my go-tos for those particular areas. So it's something to really take a look at. It's there. Let me see if I want to answer. I want to answer one question while we're on this subject right here. Let me back up for a second. Aaron, you brought up a very good question. The question is, has any patients had any problems with law enforcement when dealing with medical marijuana? Being a patient what are the advantages versus not having a medical marijuana card and dealing with law enforcement? The medical cannabis has been with us in Florida for about 3 years. Has there been some problems with medical cannabis and law enforcement? The answer is yes. Not necessarily because of anybody trying to do anything that's illegal. A lot of the, especially initially 2 or 3 years ago, a lot of the law enforcement didn't understand medical cannabis and the laws. Now, since then, there's a lot of advocate groups that have lectured and talked to. I've talked to police departments and sheriff departments on medical cannabis, and I think they begin to get the idea. If you have a medical marijuana card and you have medical marijuana products with you, you're not going to be arrested. that's legal. Okay. Now I don't suggest that you go smoke a vape pen in the middle of downtown Orlando. That's something that I don't recommend that you do, because really it's to be used in your home and be used in private. But the point is that you can possess it and you can own it. So I live in a community where when I first moved in here 3 years ago, and they heard that I was in medical cannabis, they thought I was Darth Vader. They thought that the dark side had arrived. I do have to say, after some lectures and things, we have 181 patients here in our community and now are on medical cannabis. And I've gone from Darth Vader to be the person that whenever we used to get together in gatherings, I was seeked out for information and to discuss it. I say that because law enforcement now understands that medical cannabis, especially here in Florida, unless you're in a very remote area, if you have it on you, so what's the advantage? If I have a vape pen on me, or if I have it in my car, I'm not going to be arrested. I'm not going to have it. I'm not going to be harassed, and legal. Now, obviously, as you notice, when that one lady who went to Disney and she brought in actually CBD oil. She didn't even bring in medical marijuana, and she was trying to use it in public. She was arrested at Disney because it was something that wasn't legal at that time. It wasn't legal for to be used, and it wasn't something that you should have been used in public. So I'm saying that the advantage of it is you can use it safely, and you don't have to worry about law enforcement. I say that because we do webinar. We did 134 live seminars the last 3 years before the COVID-19 outbreak. And in places like Bradenton, at the library, they have police officers. And I have to tell you, I used to love doing that one because I would have 1 or 2 police officers in Bradenton listening to the lecture just to understand what medical cannabis was. They weren't there to harass us. They weren't here to give us a bad time. And I see that same thing going on when I gave we gave seminars in Pensacola, we gave seminars in Naples and other places where they had police officers in the buildings as normal security. They would always gravitate just to learn more about it. So I think that what you're finding out is that the advantage is you don't have the fear of worrying about if you're going to get arrested for having medical cannabis. I think number 2 is you have solutions. You can talk to your dispensaries and get solutions that really help you with your problem. You don't have to overdose. You don't have, a lot of people say, well, let's just smoke a joint and everything's there. It's kind of like drinking 151 Bacardi because you want to go to a pool party. Will it work? Yeah, but you may not enjoy the pool party as much as you want to. The point is, it really helps you quite a bit. And I think the other thing is that there's not this fear that you have of doing anything illegal. It's actually very, very legal, and something that really makes a big, big difference, especially in the medical cannabis space. Do you want to make any comments on that, Kate? Anything you see on your side?
Yeah, well, so, if you have your medical marijuana card and you get pulled over regarding law enforcement, we always recommend that you keep your medicine in your trunk, just to kind of help you from getting into any trouble. But I believe, correct me if I'm wrong, I believe the maximum amount of flower you're allowed to possess on you at a time with your medical marijuana card is 4 ounces.
Right, yeah.
Which is quite a bit. So, but most patients just keep it in their trunk, especially if they're traveling from the dispensary to home or from wherever they're going. It just kind of keeps you in a more safe zone.
Yeah, I've gone into various areas where I've had my vape pens in my ashtray, and the doctor, the law enforcement person seen it, asked me what it was, and I told him it's a vape pen, and I showed him my medical marijuana card. And it's the end of discussion. It doesn't become a problem. As long as I'm not driving around smoking it, that's a different issue. But possessing it is something that's completely legal. I think the reason that Kate brings this up is a good reason. Don't tempt fate. There's no reason why you need, if you don't have to have it, just don't have it there. I sometimes get lazy, just take the pens out of my pocket and put them down. And that's probably not a good habit to be in. But I agree with her. They should be in something like the glove box or something like that. It's there. But I think the point is, you're probably not today, especially in the state of Florida, your chances of getting harassed are low. That doesn't mean that won't happen, but I would say that the chances are very low. And it's something that we really take a look at. As I mentioned, I always used to, when we did the live seminars, I would say that about 70% of them were attended by police officers, and they weren't there to harass us. They were there to learn. So I think it's something that was a good structure that's there. I think one last one I want to take, and I'll answer this one very quickly. I think Elaine asked a question, and she said, I think that it would take longer for an anti-inflammatory portion to kick in, and a stronger THC would be helpful if you've been taking it long enough for wait for the CBD to kick in. What's your comments about CBD helping with inflammation and how long it takes to kick in? Kate?
Okay. So basically, most of the physicians that I educate, I like to tell them that CBD is a lot like an antidepressant in that you can't take a CBD like you would take an ibuprofen and then expect 20, 30 minutes later that the anti-inflammation effects are gonna be in effect. So basically, CBD has to build up in your body. You have to take it anywhere from 7 to 21 days before you're actually going to really feel the benefits of the CBD. So for me personally, it's about 7 to 10 days. I take it and then I know, okay, that CBD is really working. And patients that I talk to across the board are pretty much on the same page. So absolutely, it's going to take a lot longer for that anti-inflammation effects to begin. THC is going to take your mind off of it, depending on which route of administration you choose. Vape pen would be immediately. But yes, for that CBD, I would say just start that. It's like an everyday multivitamin. Take it. Typically, patients will take, just to kind of keep everything at bay, would be 25 for otherwise normally healthy individual. They take about 25 milligrams of CBD daily. But for patients who have chronic pain, they usually start at the very minimum of 50 milligrams of CBD every day, and just, you know, wait about 7-10 days, and then you'll know, okay, this is really helping me.
That you brought up an important point, and that is that this is not like a pharma drug. This is more like a multivitamin. This is a natural remedy that works with your body, and constantly it helps reinforce your body. It's something that when you get into medical cannabis, it's something that you take every day. You know, like you mentioned, a week or two, it takes a week, for example, for you to build up. But I can tell you that as far as anti-inflammatories, CBD is much more effective than a lot of the pharma products that are out there. And it's much better for your body. Does it take a while? The answer is yes. I was over 65, played golf, walked golf courses all my life, have 2 knee replacements because of it. It does take, I basically abused my body. And so it takes a while for that inflammation to get under control. And I can tell you today, I have my inflammation under control. And that's something that's really important. And I can tell you that because I'm more flexible and also I have less pain.
And another comparison I like to make, Mark, is, you know, taking, let's just say you eat a spinach salad for dinner. You're not just going to eat a spinach salad one time for dinner and be like, all right, I'm healthy. What you're going to do is you're going to eat something green every single day to maintain that healthiness that you're looking for. And the CBD is exactly the same way. You're not going to get any benefits from it from taking it once and then not taking it again.
Yeah, no, exactly. Trudy asked a good question that we may want to answer before we get into the MÜV part. She said, I use a transdermal patch, but it won't stay on my arm. Is there a better place to put it so it adheres for a longer period? You want to comment on that?
Was this a MÜV transdermal patch?
She doesn't say.
Okay. So typically, if that happened with one of our patches, I would return it because I haven't heard of anybody having that problem with any of our patches. In fact, it's almost a little difficult to take it off. Yeah, I guess. But if you're using from another company, maybe you'd want to use some of the like surgical tape to hold it down if it seems to be coming off. I personally, I like to recommend that you either put that transdermal patch right on the area where you're feeling the pain, or usually right around your, like just below and to the right or left of your belly button, so it doesn't get in the way of anything. It's there. But typically with our transdermal patches, you can technically put them anywhere because they're transdermal. They're going to get through and get into your bloodstream no matter where they are. But then once again, if you have a transdermal patch from another company, you're probably going to have to use some tape to hold it down.
Yeah, I found for myself, because I'm fairly active, I found that I put it right in the back of my neck, right in my neck, just as far as I can reach down with my hand. I put it like right back in here. Okay. I put it right on there. Yeah, that's actually where my herniated, my neck's herniated discs are. But also because I find that when I put it there, it gets right into my blood system a lot faster, and it's not conspicuous. People can't see it. Nobody knows I have it, and it's something that. And when I put my clothes on and off, I don't bang it. I don't push it and tear it. But I'll agree with Kate. Sometimes it's hard to get it off too. It's something that's there, and I hope that answers your question. Sandra asked the question: what about the federal government? The answer is, federal government is a very interesting issue in that the cannabis, as I mentioned you saw from the Sanjay Gupta video, is steeped with politics. They're against medical cannabis, not because of the medical value of it, but because of history, a long 50, 60 years of basically pharma companies suppressing something like medical cannabis because they can't patent it. What we're seeing on the federal government level is more and more, there's kind of two, how should I say, there's kind of two camps. One that want to keep it the way it is and make it illegal, and then there's a whole camp that wants to make it legal. In fact, it's interesting that every Democratic candidate except for Biden was in favor of legalizing medical cannabis. And I wouldn't be surprised in within the next 2 years on a federal level if it's not rescheduled from a Schedule I drug. But right now we have to live with the fact that we are a Schedule I drug. Unfortunately, our politicians are coin operated. I'm not trying to be political. Whether you're red, blue, black, green, whatever, they're all bought in one way, shape, and form. And we have to get money out of politics to really get us as people to get what we really need from them. But I think the point is that right now there's a heavy gridlock in Washington, D.C. I do see, in working with people like Normal and SAFE and those other groups, we do see cracks in the armor, and there will be a vote, interestingly enough, in September. The House of Representatives has put a legislation on the table to legalize to reschedule it instead of it being a Schedule I drug, to actually take it off of the Schedule I to make it more of a Schedule III or IV, make it more of a medicine like echinacea or something like that. There is legislation that's been introduced to do that. I think it'll probably get very good House support, may even get passed. Where it goes from there, I don't know. But we do see the fact that that's being introduced on the floor for the first time is a huge breakthrough. We haven't seen that. We've never seen that. That's kind of a major breakthrough. So, like I say, pray for the federal government. I think that what's going to happen is over the next few years, especially as we get younger and younger people in the federal government, I think you'll begin to see medical cannabis as becoming something that'll become legal in going forward. It's a matter of education, and that's why I do education. The more people know, the more people understand. It's not the bad person in the room, it's the people that help you. So let's spend a moment, if you don't mind. I know that there's a lot of benefits. One of the reasons I like to work with MÜV is they've got a great set of products. You talk about the transdermal capability, the capability for cannabis to get right into your blood system. That's a huge, you kind of pioneered that and really taking advantage of it. It's something that really can make it very effective to be able to use these products. And Kate, tell us a little bit about MÜV.
Okay, so MÜV, we are based out of Florida. We actually come from a pharmaceutical background initially, and our company has taken everything that they know from a pharmaceutical discipline and put it into this nutraceutical of cannabis. And what I mean by that is, getting the relief that you need is not a one size fits all. So maybe a patch works for one person, but an inhaler would work for somebody else. And maybe somebody might just need a pain relief cream, while somebody else might actually need a capsule. So we have basically tried to make sure that we can get this cannabis into the bodies of everybody in the most bioavailable form, basically anywhere from the transdermal patch all the way to concentrates. And our company is based on research and development. So that's why you'll see the most administrative rates available to the patient. And we basically, like I said, we have everything that we have is pure. As far as our vape pens are concerned, it's all natural. You won't find any additives into our vape. All natural from the itself. So what patients get from our vapes is a more pure, more clean, less potential for coughing, and less potential side effects like a headache, which are usually caused by additives.
Yeah, I've had the pleasure of going through a couple of your grow facility, excuse me, not a couple, your grow facility that's here in Central Florida. And I was impressed, really impressed by the PhDs and by the genuine pharma approach that was taken to this whole thing. You know, you have science that's behind this. It's not just things that are being grown out on the side. It's very impressive, is what I'm saying.
Absolutely.
Get a chance to do that. You also in a lot of locations. You're opening up quite a few.
Yes, in fact, tomorrow we're opening up Port St. Lucie, and that will mark our 25th dispensary location throughout the state of Florida. We do offer delivery as well to help patients who may not be able to actually drive into the dispensary to get their medications.
Yeah, that's really important. And I think also we talked about earlier, some of the best of class products depending on what you want to use.
Mm-hmm. Absolutely.
Yeah, I think that's it. And having a range, it really makes it convenient for what you're comfortable using and where you're comfortable using it. That's something that's really, really important. You also have an RSO oil. Why don't you talk a little bit about RSO, because that's really an important contribution, I think, to the market.
Right. Absolutely. And RSO is a very unique combination because usually when you're making a distillate or any type of concentrate, you're actually extracting some of the plant out. And with RSO, it's full spectrum. Nothing has been taken out of the plant to make it. So basically none of the cannabinoids, none of the terpenes, none of the flavonoids have been taken out of this. So you're going to get full spectrum benefits. You're going to get the most healing, the most results with working on inflammation. And it can be used in two different manners. One, you can just put it directly on some food or put it on your tongue, or you can also put it on topically if you have any lesions. So RSO stands for Rick Simpson oil. So if you get a spare moment, you can go online and look up who Rick Simpson was. And it's amazing the stories that you hear of patients who feel like they really healed themselves with this Rick Simpson oil. Now I have a lot of, usually when I'm talking about RSO, I'm in an oncologist's office and we're talking about patients who are going through chemotherapy and radiation and want that additional healing property of the RSO.
Yeah, Rick Simpson's actually still with us. He actually lives in Europe right now. He lives in the Eastern Bloc country. He's very, very active. And I think I want to mention what you're saying. It's very, very effective, especially for things like cancer and all the conditions that go around it. My mother uses RSO oil and has been now for 3.5 years. She was diagnosed with breast cancer, and I basically said, "Mom, we're not going to do that." And she was 88 years old at the time, and I felt that if the chemo didn't get her, the radiation would, if not the operation, because they wanted to literally the next week do a mastectomy. Mom's using RSO oil. She's still with us. Her birthday is actually tomorrow. And what's interesting is it's very, very effective. I think it's a huge contribution. Or if you go out to the International Patients Wall, which is an area where people do testimonials, there are 60,000 testimonials on how effective RSO Rick Simpson oil is. 60,000, which is a huge, and by the way, how many people say Rick Simpson oil doesn't work? There's been less than 8 testimonials on that, just to give you an idea. So nothing's ever perfect, but I really think RSO is a tremendous, and you make a very good product. There's not a lot of dispensaries that sell RSO oil, and you make some of the best.
Mm-hmm. Absolutely, and it's really good for chronic pain too. So
yes.
Our RSO that's pictured here is actually strain specific, and so it comes. We actually have one that's really high in CBD, very small amount of THC, so you won't really feel any psychoactivity, but you're getting all the CBD effects. We usually have about 3, sometimes 4 different strains of the RSO in the syringe. We also have it in a capsule. So what we've realized is that with all these different administrative routes, probably like everybody is perfectly comfortable swallowing a pill. So it just makes it easy. You put it next to all of the other medications or vitamins that you might be taking and just pop that pill in every day.
Right. You also have concentrates.
Right. So concentrates are exactly as they sound. They are concentrated percentages of THC and CBD. This is not for your beginner cannabis consumer. Basically, usually if we're talking about the shatter or the rosin, these concentrates are where we tend to steer patients who initially are using, say, a vape pen. But if they come back and say, look, this is expensive. I'm sucking down an entire vape pen in 3 days. That's when we want to say, okay, if you're using that much cannabis, maybe we want to talk to you about using a concentrate, because for about $65, you can get relief for almost a month supply of medication with one of these concentrates.
Yeah, it's more, and again, it's something that people graduate and migrate to as opposed to start with.
Right.
And it's mainly being used a lot for cost-effective reasons. I use concentrates. I've been using medical cannabis for over 4 years, but I use it mainly for cost-effective reasons. It makes it really easy for me. So,
Absolutely.
And tell me about your tinctures.
Okay, so our tincture, the really cool thing about our tinctures is that it comes in CBD, it comes in a THC only, and then it comes in a 1-to-1. And like I talked about before, that 1-to-1 ratio is really what we want to shoot for. So I personally recommend that 1-to-1 the best. But the cool thing about our tincture versus a lot of the competitors' tinctures is that ours is water soluble. So the reality is a lot of patients might be okay with putting some medicine under their tongue, but over time it's not super desirable. But they can drop this in their drink and it dissolves evenly and you're not even going to taste it, which is wonderful. And then you don't have to worry about putting it under your tongue, and it's still going to work just as quickly since it's water soluble.
Yeah, it's a real advantage. A lot of people will use this in their coffee, for example, in the morning.
Absolutely.
And having the compounds that you use, making it water soluble, that's absolutely valuable to be able to do that. I think you use one of the competitors' products, you drop it in the coffee, it looks like a sheet of oil on the top.
Right.
And it's there. So it's something that again, making it easier for you to be able to use. And then of course you have the capsules themselves.
Right.
I'm sorry, my mouse is going crazy on me. I have a renegade rat. Anyway, go ahead.
It's no problem. So here we have the end caps, which is basically the same thing that I've been talking about, where it's water soluble. So, some patients, 25 milligrams might be a little bit too much as far as the RSO is concerned. What patients typically do, since they're water soluble, is they'll just break it open and drop half of it in their coffee cup or in their drink, and then use the other half later in the day or the next day. But they're water soluble, so you don't have to wait for your body to digest it to feel those effects. It's going to be pretty close to immediate, 15-20 minutes before you start to feel the effects, and then okay, this is really working. The problem with some of the competitors, with them not being water soluble, is they'll take a capsule, and then the patient will think to themselves, oh, this isn't working, maybe I'll take another one. And then lo and behold, it kicks in an hour and a half later, and then both of them are activated, and then you've had way too much. So this is helping patients to get the relief that they need a lot quicker, and it's also helping them to not inadvertently over-medicate themselves.
Sure. And this is what you're talking about here with your being able to make it encapsulated.
Correct. So cannabis is actually not water soluble. It's fat soluble. You put it on your skin, it's not going to do anything but sit on your skin. It's not going to break through that barrier. By changing the properties of it with this encapsulation technology that we have, we've basically just changed the properties of this, and it's basically tricking the skin into thinking that it's supposed to go in the skin, because it's tricking it into being water soluble. So you can see from the picture that it's showing how it's going into the deep layers and actually getting into the bloodstream.
Sure.
And that's not just for our patch, that's also for the evolved transdermal gel, that's also for our tincture and for our end caps.
Yeah. Very, very important. Very, very important. You mentioned strain print.
Okay, so strain print is, this is a really cool app that everybody on here should download on their phones now. Basically, strain print it's basically like a diary. And so what you can do is you put in all of your information and what you're trying to achieve, what you're trying to get relief from, and so you can track a session. You track a session and off of the your chunky diesel or whatever strain you may have, and then 20 minutes later your phone is going to buzz you and it's going to check in with you and say, okay, how are you feeling? How would you rate your pain? How would you rate your emotions? It's going to ask you everything, because typically when patients will take any type of medication, you take it and then you roll on throughout your day and you kind of forget, did that really work or didn't it? And this is really helping the patient to figure out, okay, you know, gee, I felt really good last month. What was I doing? You can refer back to it and see exactly what you were doing. Now, at the same time, there is the explore button you can push. So this is, strain print is not specific to MÜV. It is across the board. A lot of other dispensaries have signed up with this. And so patients can put in, you know, what they're taking to relieve them of what symptom. And so if you're looking to explore and see like, what have other people used for example, chronic pain? And they can see like, oh, 70% of the population likes this particular strain. So it'll help you kind of find that happy spot for yourself.
Yep. And then also you have a patient care team. That's important.
Absolutely. Yeah. So if you have any questions or concerns, you can either call or email us, and someone will be there to help you.
I know a lot of people ask me, like I work with medical MMTC, Medical Marijuana Treatment Clinics in Florida, and a lot of people ask me why. And I think you mentioned your patient care team that's here. It's really important when you're trying to get your dosing correct to have a support team with you. MMTC is the only set of medical doctors in the state of Florida, actually in the United States that I know of, that has a call center. So if you're one of their patients and you're trying to figure out what products you should use, you can call and they'll put you in touch with the practitioner. But where we mainly see where it's used is a lot of times a patient will be at a dispensary. They'll be at a MÜV dispensary and they have some questions, and the dispensary personnel could use the help of a doctor to help figure out what's the best strains to use. You can actually call MMTC to put you in touch with the practitioner, and then you now get the doctor's part of it as well as the dispensary part to really help you with the medication that you need.
Yeah, that's wonderful.
And I think this patient care team, I can really not stress how important it is to have a team behind you, not just do it yourself type of thing. And then you have also a frequent flyer program. You get earned points, right?
Yes. So we actually have a few different things going on, but the U points is for every dollar you spend, you get a certain, you know, it kind of accumulates, and then you, by the time you've spent a certain amount, you can get a certain amount off. So I think once you spend, and this is kind of a lot, but once you've spent $1,000, you get $80 off. So, but you can also redeem it much sooner than that, just for less, you know, $10 off here and there.
Great. And of course you have discounts for veterans, seniors.
Absolutely. So the first time you come in, no matter what, you're going to get 25% off. Senior citizens, they get 10% off, veterans, 20%. And then also, if you go to your physician, an MMTC physician will definitely have our cards. You'll receive a card that gives you 25% off on your, technically it'd be your second purchase. And then the third one, you'll get $75 off. And the fourth one, you'll get buy one, get one free. So that's a great card that you can only get from your physician.
Right. Right. So, and then you mentioned the seniors. I think you also have senior highlights.
Yes.
Spotlights, I should say.
Yeah, senior spotlight. It's usually on a Sunday, a couple times here and there. Recently, we did it for the whole month of July, and then in August, we've done it on 2 other Sundays. Senior citizens love it. The med tenders are there in a, you know, definitely more focused toward the senior citizens and educating. They educate every day, but it's a little bit more. They have something extra on that senior citizen Sunday.
Sure. So, I mean, you're really reaching out to really provide something for all the different patients. And again, you do have delivery, which is important. I think you deliver what, within 25 or 30 miles of your dispensary?
Right. Well, so it just depends on the location. Some of the dispensaries are a 30-mile radius and others are 20, kind of just depending on the number of patients, I believe, so that we can serve everybody.
Yeah, I think that's important, especially in this COVID environment.
Right.
So listen, I want to thank you, Kate, for helping me with and cover up the MÜV. If anybody has any more questions, please bring it up. I do want to mention, Elaine asked a question about my mother and the glaucoma doctor, and she says if the doctor knows that she has glaucoma, isn't it malpractice for him not to prescribe it? Well, this is where the federal government comes into play. This is where the doctors are caught in this interesting world where they know that there's something like medical cannabis can help, but the AMA will take their card away if they recommend medical marijuana. Okay, so that's where that's why medical marijuana doctors exist. That's why MMTC exists, because these doctors have stepped up and said we're going to recommend medical marijuana. So far, none of them have lost their AMA cards, and I don't think the AMA will do that. They're more threatening than anything else. But the answer is doctors walk a fine line, and what they really want to do is also make sure their patients are receptive to this. My mother was not very receptive until she got cancer to the marijuana in general, or medical marijuana. She was your classic Italian, Portuguese mother. The minute she had a problem though, and it started helping her, she became an advocate. So that happens quite a bit in the case of cannabis. It's a matter of people are for and against. But I want to go back and mention, when you're taking a look at remedies like this, you want to get a sense of balance. You want to get a sense of you want to restore your life. You want to control your control. It's a matter of just doing some basic things like watching your eating, exercise, paying attention to yourself, and being able to do something that can really help. That's what's really important. So I'm going to kind of quit the slideware for a second and get out of this and see if there's not any more questions. But I don't see any questions right now. But Kate, do you want to make any final comments?
No, I guess if you have any questions at all regarding strains or what would be the right thing for you, and you just want to physically talk to somebody, definitely come into MÜV dispensary, and also at the same time, if you just want to pick up the phone, you can call any MMTC with their, or are you guys available from 9 to 5, or what are your hours?
Actually, 8 to 5.
Okay.
Yeah.
So it's perfect. There's a lot of information out there. Definitely download that strain print and start doing some exploring from home tonight. Another good website to go to is Leafly. A lot of patients will get some answers from there. But I'm enjoying strain print and what it's doing to help patients really without all the confusion, just getting you the answers that you need.
Yeah, and strain print is open to everyone. It's not just a MÜV thing. It's an open thing.
Yeah,
so
it's open to all the dispensaries.
Well, Kate, I want to thank you very much for helping me. MÜV has been a great partner, and we really appreciate it. I thank your comments in the beginning. The compliments get you everywhere, and we appreciate it. I do want to mention this is the last webinar in our summer series for the medical marijuana awareness seminars. For those of you that have tuned into a number of these, we will be doing another seminar series starting in the middle of September, and I'll be announcing that probably early September as of what we're going to be doing. That next webinar, our next webinar series will be not only just talking about lifestyle medical conditions, but also we're going to drill down and go in depth into a number of the organizations and operations here in Florida. And I'll kind of leave it at that. We're going to be kind of opening up as to what cannabis is all about and how it works, but more importantly, absolutely more importantly, how it helps you. I hope that this has helped you, and I hope that you've got some information out of this that'll be able to help you with your lifestyle medical condition. You're not alone. I think that's what's important for people to understand. A lot of times you get a medical marijuana card and all of a sudden you're floating out there trying to figure out what to do with it. You're not alone. You have dispensary personnel, you have doctors, you have people that are practitioners that are there to help. And believe me, this is what it's all about. The one thing that I enjoy, one person asked me, one of my neighbors who's retired said, how come you just don't retire and play golf? One of my bad habits is golf. And I basically said, it's very hard for me to do that. Mainly because I see on a daily basis the number of people that get helped by medical cannabis. And I hope that you become one of them. It's something that really is important for everybody. So we will be back next quarter. One last question. Angel asked the question, why are there so few dispensaries in Lake County? It's because Lake County voted against allowing medical dispensaries to be in Lake County, just for your information. So it's very simple. They just didn't allow them. Now, I do know that that's up for review. I know there's a lot of discussion on that. I do know the city of Claremont came out and actually have passed a resolution that would allow medical cannabis to be put in the city of Claremont. However, being in Lake County, they still have to get over that. But I think it's something that it's coming. I think the movement is here. People are seeing the results. My neighbors are seeing the results, and so it really speaks for itself. So hopefully you can help us keep the ball rolling. And I want to thank everybody for joining us, and I want to thank everybody for their time and for sitting in. Next quarter we'll be doing this again, and like I said, it'll be a lot more interesting subjects And again, thank you, everybody. And Kate, thank you and MÜV for being here. And a couple of people that don't get a lot of thanks, and that's in the background, Lee and Deja have been helping us quite a bit, putting this all together. And I want to thank them for their help. And also somebody who's never mentioned, who really was the person who put this together, Alyssa. Alyssa Katera is the person who came up with the concept of CanaJets, and that's what we're doing. So I'm getting emotional because I really love what she does. Anyway, thank you very much, and we look forward to seeing you next quarter. Thank you very much.
Thank you.